I have worked with heart patients for many years, and there is a truth that many families learn too late. A large number of people over 60 in India do not survive their first major heart attack when they are alone at home. They collapse before they reach the hospital. They hesitate. They hope the pain will settle. They do not know the first few simple actions that can keep blood moving until help arrives. Almost half of deaths from heart attack happen before the patient reaches medical care. The heart is injured quietly for years, and then in one short window, a final chance is given. If that window is missed, there is no second chance. If you are above 50 or live with high blood pressure, diabetes, cholesterol, or long-term stress, this message concerns you directly. You may feel normal today, but if you do not know what to do in the first 10 minutes of a heart attack, your life can end on the floor of your own house. I am Dr. Heartwise. In this video, I will guide you through clear steps that can improve your chance of surviving a heart attack when no one else is near you. You will hear what to do first, whom to call, how to position your body, how to support your heart, and how to prepare in advance. Treat this time as a serious consultation for your future self. If you already know an older relative who spends time alone, keep watching and plan to share this video with them after you finish it. In many Indian cities, the pattern repeats. An older person feels a strange pressure in the chest, or a heavy weight in the center of the chest or upper back. Breath becomes shorter. A cold sweat appears. Sometimes there is pain in the left arm, jaw, or neck. Often the person tells themselves that it is gas, tiredness, or acidity. They decide to rest for a while and see if it passes. Time passes, but blood flow in a vital artery is blocked. Heart cells are starving. The person does not call for help because they do not want to disturb anyone or because they are not sure. By the time family members reach home, the golden window for saving heart muscle has closed. The damage is severe, or life is already lost. Cardiologists sometimes use a simple phrase: time is muscle. Every minute in which a major artery is blocked kills more heart cells. Every minute in which blood flow is restored saves heart cells. The difference between walking out of the hospital and never waking up can be measured in minutes. In an ideal world, every person over 50 would know exactly what to do the moment heart attack symptoms begin. They would call the local emergency ambulance number without delay. They would take the right medicine in the right way. They would position their body to reduce strain on the heart and keep oxygen moving. They would unlock the door and keep the phone near them so that help can reach them fast. In reality, most people have never been taught these steps. They hear myths from neighbors or social media instead of clear medical advice. The purpose of this video is to change that for you. If you are above 50 or have parents or grandparents who spend time alone at home, I invite you to listen carefully. In the next part, I will explain the very first steps that must be taken in the first minutes of a suspected heart attack. Press like on this video so that more families in India receive this information before a crisis happens, and stay with me until the end. When you suspect a heart attack, the first two actions are the most important. Call for medical help without delay and support blood flow to the heart while you wait. This part builds a small but powerful survival plan for those first minutes. The moment you feel strong chest pressure, heaviness in the center of the chest, sudden shortness of breath, unexplained nausea, or a cold sweat that comes with discomfort in the chest, treat it as a possible heart attack. Do not wait to be 100% sure. It is safer to act and later hear that it was not a heart attack than to wait and lose your chance. First, use your phone to call the emergency ambulance number used in your region and clearly describe your age, your symptoms, and your location. If you cannot remember the number, keep it written near your phone or saved as an easy contact. Do not plan to travel by yourself on a two-wheeler or drive a car. While driving, you may lose consciousness and harm yourself and others. An ambulance team can begin treatment on the way and take you directly to a hospital ready for heart care. Second, if you have been told by your doctor that you can use aspirin in an emergency and you are not allergic to it and you do not have a bleeding disorder, you may chew a plain aspirin tablet after calling for help. Chewing it rather than swallowing whole allows it to enter the blood more quickly. Aspirin helps to slow further growth of the clot that is blocking blood flow. This can keep some blood moving until a full treatment is given at the hospital. Some people keep a small strip of plain aspirin in a known place in the house, or carry one tablet when they go out, so that they or their family can use it quickly if a doctor has advised this option. Do not take aspirin in this way if your own doctor has warned you not to take it, or if you know you have serious allergy or stomach bleeding problems. Third, if there is someone nearby, tell them clearly what is happening and ask them to stay with you until help comes. If you are alone, unlock your main door now while you are still able to walk a few steps safely. Then come back to a stable place to sit. This small step can save precious minutes when the ambulance arrives. The first actions are simple, but many people never take them. They delay the call, they search the internet, they wait for family members to return. These delays can cost a life. If you found this part useful, write in the comments whether you already keep aspirin and important phone numbers in an easy place at home. If you know someone who should hear this, share the video with them after you finish watching. After you have called for help and taken emergency medicine if advised, the next steps are about how you position and use your body while waiting. The goal is to reduce the workload on the heart, support breathing, and keep blood moving to the brain for as long as possible. In this part, I will describe simple actions that can help. Once the call for help is made, move to a place where you can sit with your back supported and your upper body slightly raised. Sitting upright at a gentle angle reduces pressure on the lungs. Air can move in and out more freely, and the heart does not have to fight against as much fluid pressure. Avoid lying flat on your back unless you begin to lose consciousness and someone else is guiding your position. Loosen tight clothing, especially around the neck, chest, and waist. A tight collar belt or waistband can restrict circulation and make breathing more difficult. Releasing this pressure allows the chest to expand more easily and supports oxygen flow. Keep your phone close and on speaker if possible so that you can talk without lifting your arm for long periods. Follow any instructions that the emergency operator or doctor gives you over the phone. If you start to feel very lightheaded, as if you are about to faint, take one deeper breath and cough firmly from the chest. Some doctors refer to this as a way to temporarily support blood flow during dangerous heart rhythms. The forceful movement of the chest can help push blood through the arteries for a short time and keep you conscious until proper treatment starts. This is not a cure, but in some situations it can buy a little more time. It should only be used while you are still awake and able to cough in a controlled way. Throughout this period, try to keep your body as still as possible. Every step or sudden movement demands more oxygen from a heart that already has limited blood supply. Moving around the house to finish small tasks or to search for things may push the heart into more serious damage. Slow, controlled breathing is also important. Fast, shallow breaths increase panic and stress hormones. Instead, place a hand on your abdomen, feel it rise gently as you breathe in through the nose and fall as you breathe out slowly through the mouth. Aim for smooth, steady breaths. This kind of breathing helps calm the nervous system and can lower strain on the heart. In a heart attack, your heart is like an engine running with very little fuel. Every extra demand can break it. Staying seated upright, loosening tight clothes, keeping movement to a minimum, using steady breathing and controlled coughing when you feel faint are simple tools that can support you until the ambulance arrives. If you learned something new in this part, write one action you did not know before in the comments. Press like if you want more videos that teach clear emergency steps for heart and brain health. So far we have spoken about what to do in the middle of a crisis. Now let us talk about preparation. The time to plan for a heart attack is not when your chest starts to hurt. It is today when you are calm. There are several small habits that can greatly improve your chance of surviving a heart attack if it happens while you are alone. Keep important phone numbers written clearly near every phone in your house and saved as favorites in your mobile. This includes local ambulance services, nearby hospitals, and close family members. Practice saying your address slowly and clearly so that in stress you can still give it without confusion. Discuss with your doctor whether you should keep plain aspirin at home for emergency use and in what dose. If they agree, store it in a place that is easy to reach and known to you and your family. Teach family members when it can be used and when it should not be used. If you live alone, consider simple devices such as a phone with a strong ringtone next to your bed, or chairs, or a basic alert system, so that you are never far from a way to call for help. Keep your main door locked in a condition that can be opened quickly from inside. Just as important as emergency tools is long-term prevention. Control blood pressure, sugar, and cholesterol through regular checkups and prescribed treatment. Avoid smoking and heavy alcohol intake. Give your body daily movement and protect your sleep. Each of these steps makes a heart attack less likely and, if it still happens, more survivable. If you have watched until this point, you already care about your future health or the health of someone you love. Do not let this video be only information. Turn it into action. Today, after this video ends, write down the emergency numbers you need and place them near your phone. Check whether older relatives have these numbers and whether they can use them in an emergency. Discuss with your doctor about keeping aspirin or other emergency medicine at home if it is safe for you. In the comments, tell us where you are watching from and whether you or your parents live alone for many hours in the day. Share one change you will make this week to be better prepared. Your plan may give another viewer the courage to prepare as well. Press like on this video so that more seniors and families in India see it in their recommendations. Share it with at least one person over 50 in your life. Subscribe and turn on notifications so that you receive the next lessons on heart attacks, stroke, stress, and brain health from Dr. Heartwise in time. Knowledge about emergencies only protects you when it is already inside your mind before the event. Start preparing today so that if a heart attack ever comes, you are ready to fight for your life instead of freezing in fear.